Hi, my name is Melanie and I am your IVF nurse. This week's topic is actually kind of a request from someone on YouTube who reached out to me, Ashley C. from New York City, who is a new graduate of, she's a registered nurse and just recently accepted a position in an IVF clinic. So congratulations to her. She was asking what it was like a day in the life of an IVF nurse. So in my experience, how it's always been was that you're starting at your assigned time or your scheduled time. And usually if you're in a little bit early, you're checking either phone messages or email messages from patients, because patients will reach out to you at all hours of the night, especially if you've got international patients that may have questions, so they're dealing with time zones. And a lot of the times they will think that if they're reaching out to you in the middle of the night, that, you know, if you get their message first, that you'll be replying first to them. So replying to messages via email or telephone is always important. But once you start, usually the breakdown is that if you've been assigned to the operating room, you're either setting up or So if you've been scheduled to work in the operating room or the procedure room, what you would do is go and set up for your day. And you may have done this the day before, just setting up or pulling out your supplies, making sure that you've got everything you need for the number of cases that you have for that specific day. So what happens is that once you've set up in the procedure room, then most times you're coming out helping with cycle monitoring, or depending on how big or busy your clinic is, you would be welcoming your patients and doing your pre-op with them. Their vital signs, any medical history, making sure their consents are all done and completed, and then putting in the IV, depending on where you work. Sometimes if you've got an anesthesiologist, they will put in the IV, so you're just going to make sure that they're all set up and ready to go, and that they've had nothing to eat or drink prior or from midnight the night before, just to make sure that whatever medications they do receive, they're not going to be hopefully not throwing up from the medications they do receive during the procedure. Now, if you are in the procedure room, you might be a nurse that's sedating. You could be a circulating nurse as well, and sometimes they play a dual role of sedating and circulating, so assisting the doctor. Or you could be assisting the doctor in scrubbing, so handing necessary instruments to the doctor during the egg retrieval, maybe exchanging tubes and passing them to the lab assistants or embryologists there. Once you've done that, then once the procedure is done, what you're going to do is probably flip the room, as we would say, and get ready for the next case. If you're in recovery, then you're going to be monitoring your patients as per your clinic guidelines. Usually it's vitals every 15 minutes for the first 30 minutes, and then making sure that your patient is stable and able to tolerate fluids. And then from there, if they're okay and they're walking and not vomiting and they're tolerating fluids, if they've brought a snack, then usually they're good to review any instructions, and then from there they can be discharged. So usually in Toronto, it's about an hour for their recovery time, and they cannot drive, so they do need someone to accompany them or come and pick them up. Now, the other thing is that if you're working in, say, where they do cycle monitoring, what's going to happen is that you're going to see your patients after they've had their ultrasound. If your facility is large enough and they've got their own blood machines, usually what happens is that the bloods come back about an hour to an hour and a half later, depending on what you're running. And then from there, once they've had their ultrasound, you would see the patients based on those results, and then advising them of any needed medications or instructions that they'd have. If your clinic is one that has patients wait for their blood test results, then once they've got their blood test results, you want to get them ready for their medications, make sure they've got enough supplies to do their shots, all that fun stuff, and then you're sending them off. So usually cycle monitoring is a couple of hours, so usually from about 7 to 9 or 9:30. Some clinics have cycle monitoring all day to accommodate for international patients that may have flown in. Most times what happens is after the procedures are done in the OR, The nurses, if there's nothing left to do there, if the patients have been recovered and discharged, they will come out and help with the cycle monitoring nurses. So help finish up cycle monitoring, answer to any correspondence or voicemails that patients have sent. If meds need to be shipped out, sometimes the nurses are shipping out medications. And then from there, you would be providing your daily instructions to the patients once you start receiving your blood test results and the doctor has reviewed them. So quite a busy day. You're kind of go, go, go. For a new nurse, even a new nurse at a clinic, if you've worked at other previous clinics in the past, I've always found that it does give you the advantage because reproductive nursing is similar across the board in the way that the body works. However, every doctor is a little bit different in terms of their protocols. So that's more of the scope that you're learning when you're going from clinic to clinic, just how the different protocols may vary. And some doctors have their preferences as to which protocol they prefer. And you'll find that certain clinics will have certain demographic of patients, so maybe a certain age group, or they may have predominantly more third party or egg donor cycles, where maybe the protocols are more specific to an egg donor cycle. Some clinics will cater to an older demographic of patients, so you could end up seeing things like natural cycle IVF or low dose stimulation, because the older you get, you could then technically fall into a poor responder category because your AMH is low, indicating or it's appropriate for your age, which means that your ovarian reserve is low. Your FSH could be high, indicating, perimenopause or even menopause at that point, depending on what your FSH levels are. Your periods may be irregular because you're approaching menopause. All of those things are commonly seen at clinics. And like I said, every clinic is a little bit different in terms of the protocols they use and the specific demographic. Usually across the board, though, you do tend to see a good mix of people right across. Now, throughout the day, what I have done as well is that when you're meeting with patients, what you want to do is talk to them and really listen to them, because you'll find that patients will tell nurses a lot of things that they may not be telling their partners, a lot of things that they may not be telling the doctor. So usually the nurse has a really good relationship with the patient. The other thing is that some of the nurses, depending on the clinic you work at, actually do the inseminations as well. So that's always a good skill to learn if that's an option for you at your facility. The other thing that you want to take into consideration, or what I always tell people, is that you want to treat the patients that you're dealing with on a daily basis as though you would want to be treated if you were going through this, because a lot of the times clinics are busy, patients feel like they're rushed, they're overwhelmed when you're dealing with everything that is quite invasive, having transvaginal ultrasounds, daily injections. All of those things are really invasive and not the norm. So going through all of that can take a toll. Plus, there's crunch time to get to work or drop children off, or you're switching with your partner who's got the responsibilities. You may have meetings to get to, appointments to get to. So all of those things are stress factors which can affect how the patient is going through their day. So taking all of that into consideration is really important, and it can be pretty exhausting as well in terms of, as a nurse, listening, trying to be there for patients, trying to do your best. One of the things that I always kind of not necessarily suffer from, but what I've learned over the years is that it's important. So patients waiting for their protocol, it's kind of like every second waits. They want to be planning their lives, making sure that they get their information, that their information is correct. So you always want to be making sure that you're sending them correct information. If you don't, do apologize. I always say own up to your mistakes. Everybody does make mistakes, but if you're not sure about something, check with somebody, verify, even with the doctor, if you're not sure about the specific orders, if it's something different that you may not be used to. So those things are all important. So the day A day in the life of an IVF nurse is really quite hectic. You're kind of go, go, go. There's many times that I'm, eating at my desk, all that kind of stuff, which is fine because in my brain I'm always thinking, oh, I have to get this email out, or I need to be responding to this patient, just because I know that this patient may be a little bit more anxious than, say, somebody else, but it's just something that I've always done, to take into consideration of the patients, to make sure, because it's what I would want. I would want, if I was going through it, then I would want them to be, considerate to my needs and what I'm thinking if I'm trying to plan my life or travel or work or, my children's lives or, whatever. Maybe if I'm trying to do all of those things, I want to get as organized as I can in planning this. The other thing that I think is that it's important to let all patients know that going through an IVF treatment is a commitment, that there is times when they may be late for work, and if they can, let their employer know. You need to have your blood test and ultrasound to make sure that you are being monitored properly. So all of those things are really important. Now, on my downtime and when I'm not in the office or working for myself, what ends up happening is that I try and spend as much time with my family. This weekend I am in Windsor, Ontario, cheering on my niece, who is the result of insemination, third insemination with the use of Puragon, or Foley stim as people in the States or Europe may know it. And so she is 7 years old and she's playing rep baseball and she's doing a great job this weekend. Today is their championship game, so we'll have to see how they do. And then we are off to Port Dover to visit my father as well. So family time is important. I've got my daughter with me as well. So all of those things are really important. And then, of course, reaching out to you every Sunday to let you know what's going on with me and addressing any questions or concerns that you may have for me. And I am your IVF nurse. Thank you for watching. Have a great day. And if you'd like to email me, it is yourivfnurse@gmail.com. Feel free to check out my webpage, www.yourivfnurse.com. Thanks.